Today we are going to discuss about a very common disease which we known as a typhoid fever. The main culprit of this disease is Salmonella typhi, and the typhoid fever is caused by paratyphi uh, A, B, and C. This disease was once very prevalent around the world. The term typhoid is coined by Louis in 1829 and in 1856, but pointed out that this figure is transmitted through the excreta uh, of human beings. This infection is acquired by ingestion, and once it reaches the gut, it attached to the microvilli of iliac mucosa and penetrate to the lamina propria and submucosa. Then they are phagocytized by polymorphs and macrophages. The ability to resist intracellular killing and multiply within the cell make this virus different from make this bacteria different from other bacterias, and that's make him very virulent. They enter the mesenteric lymph nodes and where they multiply, and via thoracic duct they enter into the bloodstream. The incubation period of this disease is usually 7 to 14 days. If we come to the clinical features of the disease, the onset of this disease is insidious. The temperature raises gradually in a step-ladder fashion. Afterwards, there is a malaise, increase in headache, drowsiness, and constipation, and aching in the limbs. Cough and epistaxis may also be occur in this disease. Although in children, diarrhea and vomiting is very prominent. At the end of the first week, rashes appears, and one can spot these rashes in a red rose spot. They generally, you can see these spots in a white skin. Up to 7 to 10 days, spleen may be palpable. During that phase, constipation is superseded by diarrhea, and abdominal distension is superseded by the tenderness on the right iliac fossa. Bronchopneumonia or bronchitis and delirium may also be developed. During that phase, a patient may be profoundly ill until the proper antibiotic therapy is not given to the patient. And later on, when the toxemia increases, patient may reach to the coma, and finally it reaches to death. In paratyphoid fever, rashes is very frequent, but the intestinal complications are less frequently. If you come to the laboratory diagnostic, in bacteriological diagnostic, we generally isolate the bacilli from the patient and demonstrate the antibodies. We can do this by blood culture and your feces culture and urine culture. However, the urine culture is not very useful because bacteria shedding in a urine is irregularly, so that the proper result we cannot obtain. If you come to the treatment part, patient is advised a complete bed rest, and proper nutrition and fluid intake should be monitored. Chloramphenicol should be given at least 14 days, and its substitute is amoxicillin, is a choice of drug in typhoid fever as well as paratyphoid fever. Pyrexia may be present for around 5 to 6 days after the start of antibiotic therapy. Patient is considered to be infectious until or unless its stool or urine culture comes negative at least 6 to 7 times. Those who travel or live to the countries where typhoid is endemic, they should get monovalent typhoid vaccine. So this is for now, and I hope that you like the video. If you like this video, please like and subscribe it, and we will meet in the next video. Till then, thank you and bye bye. Take care.